nice to see all of you. My trouble getting here were those two seasons we have in Montana, winter and highway construction. I got caught in our highway construction season, and thus our short delay here. I thank Molly and others for waiting for me. There are 150,000 Montanans without health insurance coverage. That's disgraceful. There are 296 million Americans with no insurance coverage for their health care needs. That's a catastrophe. Montana and all Americans need affordable, quality health care insurance coverage now. Our employers want it, and so do their employees. Our healthcare workers want it, and so do the hospitals and clinics. Public demand for reform of healthcare insurance is about to reach its crest. The public pressure for change, starting in this year's presidential and congressional campaigns, is unstoppable. The next president and the next Congress, both sworn into office next January, will be forced by public pressure to confront this great national imperative. The medical and insurance hardships that face middle-income Montanans is not a campaign slogan or political rhetoric. It is real. And if you're one of those hardworking Montanans who can't afford health care, it is damn real. The cost of staying marginally healthy is continuing to spiral upward. The price of prescription drugs has been rising at twice the rate of increase in the income of the average working Montanan. And those medicines usually prescribed for the elderly are going up faster than that. The elderly are on fixed incomes. The current healthcare insurance system is in serious, serious condition. It is full of wasted money, uneven access, patchwork coverage, and cost shifting. Remember that thing about there's no free lunch? Well, the costs are being shifted to those of you who have insurance. It's being shifted to those hospitals which for 20 years are going broke and closing in record numbers in small towns such as we have here in Montana. We Montanans spend almost 16% of our economy on health care. Now that's a larger percentage than is paid by the people of Germany or Switzerland, and they're in second and third place as the most expensive healthcare countries in the world. Their care is better than ours. They just pay less for it. Montana's businesses have been asking for some kind of appropriate financial relief from rising health care costs for their employees for no less than 2 decades. When I chaired the Labor Management Committee in the House of Representatives, 3 committees that was charged with health care. We were trying to do it during the years when former President Clinton sent his plan for universal coverage to the Congress. medium, and large businesses from around the country came to me and the members of my committee and said, please pass some kind of universal coverage. And the big three automakers came in to see me, two of them with their CEO. And they said, we think we have a little less than a decade left in which we can compete with foreign automobile manufacturers. And the reason is not American ingenuity, although they admitted they were a bit behind in the design of the kind of cars that Americans wanted. But they said our problem in competing internationally in the automobile market business is the cost of health care in America. The cost of health care to us, the big three, for our employees. Health care that we want to deliver. And then they said something to me that is now public knowledge because they've said it in many places, but I was shocked to hear it then, and the situation is worse now, and that is the big three pay more for health care insurance than they do for the metal in their automobiles. And sure enough, 20 years later, they're almost non-competitive with the world's automakers, and the big three, as everyone knows, are going broke. So the tragedy is across the board, affecting large and small alike, and it is significant here in this state. And our group, along with groups in every other state, are beginning today, us at this press conference, to help build the public pressure to convince the next president, Congress, and in particular, the Montana congressional delegation, to set aside the public apathy and fear of political repercussions that has infected our elected leadership for more than 20 years with regard to health care. Set aside the apathy. Let's follow the American people toward change for a change. And that includes reform of health care insurance. Thank you.